I'm Shahriyar Hirjakaka, and I'm the primary caregiver for my mum, who's over 90 years old. And in the past, we've always had problems waiting for services to be given to us whenever we required them. In 2019, when my mum ended up having a compression fracture of the lumbar vertebrae, she was unable to move and get out of bed. And she was in excruciating pain for quite a bit of time. When we reached out to Dr. Pereira, he introduced us to Scope, and within a couple of days, I'd say probably even less than 48 hours, we got someone to come in and assess the situation.
So from a provider perspective, you basically just call a number, the Scope line, which is open 9 to 5, and you'll pick one of the options, so option 1, 2, 3, or 4, or 5, depending upon what service area you need. So if I need diagnostic imaging, and I've got a patient in my office, whether that's virtual or in person, I'm able to make that call in real time.
It's huge value to just get that peace of mind at the end of the day that not only that they had the test, but we get the results back the same day. And that way, if it is something serious, we can act on it right away. And if it's not, I just have that peace of mind. And they have that peace of mind also.
It's a sense of knowing that you've got almost an extension of your own office administrative team on the line who is really just there to help you.
It's an excellent program, and I think everyone should be aware of it, and especially the physicians, and they should promote it, and make use of it, because a lot of people need this kind of service, and people are frustrated waiting. At least for my mom's situation, I think it was like the best thing that could happen to her, because we got all the sort of appointments and the dates, really fast.
I had a rotator cuff injury in 2019. So for my first MRI and my first appointment with a specialist, I had to wait for 6 months probably. Because of that 6 to 8 months time lapse, I could have lost probably use of my arm. For me, and I'm sure for most family members or caregivers, the most important thing is that we receive the support and receive the service when it's required without having to wait. Waiting is very stressful when you need something done immediately.
It is going to provide physicians that extra support if they need. And in today's world, where there's so much complexity in dealing with patients and patient care, I think having access to a specialist, having access to getting tests done in an urgent manner and an expeditious manner, I think is really good, because I think it will help relieve some of the tension and stress in the management of the patients.
We never had anything like this before, so I think it's a real game changer for both providers and patients.